The 11th edition of the Walk Away Cancer Campaign, Nigeria's largest cancer awareness and prevention event, took place at Mona Lisa Park, Abuja, bringing together thousands of participants from across the country in a national show of solidarity, hope, and advocacy for improved cancer care. The annual walk, organized by the Medicaid Cancer Foundation, MCF, has grown into a unifying movement for early detection and prevention, drawing the participation of state first ladies, health advocates, cancer survivors, and partners from across Nigeria. Dr. Zainab Shinkafi Bagudu, founder and CEO of the Medicaid Cancer Foundation, said the walk, which began 11 years ago, was initiated to raise awareness, funds, and policy support for improved cancer care in Nigeria.
Walk Away Cancer is an 11-year-old initiative of Medicaid Cancer Foundation. We started doing this to raise awareness, to raise funds, to call on policymakers to create a more conducive environment, a stronger health system for cancer patients in Nigeria. Top of the list, we are calling on government to allocate more resources so that we can go through the entire cancer spectrum, from awareness, vaccination, diagnosis, treatment, and palliative care. The bulk of our patients are at the other end of the spectrum. We diagnose patients in stage 3 and 4, and so they have just 25% survival rate. In countries like Australia, UK, US, China, the early diagnosis makes it possible to have a 90 to 95% of 5-year survival rate. So I'm very grateful to all our partners that have come out today.
Also speaking, Chioma Uzodinma, First Lady of Imo State and Chairperson of First Ladies Against Cancer, FLAC, said early detection, screening and awareness remain the strongest weapons against the disease.
We at First Ladies Against Cancer, we create awareness and advocacy, encouraging people to, and even paying for people to go get screened, free screening this month of October in all the flag states. I know that there's been a lot of activities, free screening services. Recently launched a breast cancer screening center in Ogun, partnership with Roche, we even pay for cancer patients, their chemotherapy, radiology, and all that, and we support survivors. So we join hands together, and also as a country, to say that we'll fight cancer and we'll win cancer.
Some cancer survivors share their experience, urging the government to provide free or subsidized treatment for patients.
I've been a survivor for 11 years, but unfortunately I left Transcorp 2020 because of COVID-19. But since then, God has been helping me to go for my checkup myself, and it's not easy. An applicant still taking up on himself with cancer, you know what that means. No government support. We've cried to government up to now, nothing. I attend all seminars, all conferences. We'll go and talk, we'll go and showcase ourselves. No call from government.
I think the government should look into the cost, because let's assume that I was opportunity to see 1 or 2 persons that supported me, but not all the time. The little money I saved, up to now I have not recovered, because I spent up to more than 10 million naira. And my pet care is $800, which I have not done, about 1.something million. And I did my chemotherapy since February. I've not been able to go for the pet care because of funds. Because along the line, the treatment, you will have crisis that will refer you to go and do MRI. Those things are expensive. Not everybody can afford it. You understand? So I just feel that the government should look into this.
The event featured solidarity walks, speeches, musical performances, and health talks. It also attracted dignitaries from the public and private sectors, including state officials, diplomats, medical professionals, and cancer survivors support groups. This year's edition reaffirmed Walk Away Cancer's role as a catalyst for advocacy and change, promoting early detection, improving access to treatment, and inspiring hope in the fight against cancer in Nigeria.